I'm Dr. Julie Elner. You're watching Chapter 3 of my bariatric surgery video. We'll just pick up where we left off in Chapter 2. This is Sarah. She's a patient of mine who eventually became a personal trainer, and she's now a personal trainer specializing in patients who have had bariatric surgery. I actually have a couple of patients who've become personal trainers. It's really nice for my patients to be able to go to a personal trainer, especially someone who understands their process and understands their history coming up through surgery and losing weight. We certainly can't talk about the medical problems that go along with being overweight without touching on depression. If you're at your normal body weight, there's a 20 to 25% chance that at some stage during your life, you're going to have an episode of depression as a result of perhaps something terrible happening in your life. Maybe there's a divorce, maybe there's a death in the family. If you're in California, maybe your house was wiped out by a fire. We have these tragedies in our life, and people get depressed for maybe 6 to 12 months. You may or may not have to take medication to get through it, but there does come a time when the chemicals kind of reset inside the brain and you can hike up your bootstraps and get on with life, and it was just a temporary spell. But look at the statistics on the slide for patients with morbid obesity. 89% of patients with morbid obesity struggle with depression. And this isn't an episode that happens and then stops. It's a chronic disease, and it's a terminal illness that people have spent years trying to get a hold of and trying to get under control. So it's no wonder why 3/4 of my patients are on antidepressant medications when they come to me. Just as an aside, kind of associated with this slide, people ask me all the time why I do this kind of surgery, because I would look like a naturally skinny person who wouldn't have the slightest clue what it feels like to walk around in a body that hurts all the time and doesn't fit, never mind the emotional struggles that people have with obesity. And the reason I do this kind of surgery is because obesity is what kills my family. I've watched all of my grandparents die of obesity. I lost my grandparents when I was really young because of obesity. My mother and I just happened to get the skinny genes, but the rest of my family wasn't so lucky. I just lost my brother recently. I'm watching my aunts and my uncles and my cousins and my father who are losing mobility, losing years of their life, and losing their health due to obesity. That's why I do what I do, because I've watched the ones that I love the most ultimately die of obesity. This is a patient of mine, Robert, who came to me close to 500 pounds when he wanted surgery. And he went on a surgical preparation diet, and he actually lost almost 100 pounds just on that diet. But 10 months after surgery, he was down a total of 250 pounds. His life change has been indescribable. He's a lovely man. He's on the website. You're more than welcome to call him up or to email him. He has a lot of insight. He'd be more than happy to chat with anybody who has questions about how surgery is to live with and how surgery is to go through. And he's years out of his surgery right now, and he can share his long-term success with you. So let's talk about all the things that we have tried for management of our weight outside of surgery. Well, we have the diets, we have physical activity, we have drugs, we have behavioral therapy, we even have acupuncture, we have hypnosis, all the things that my patients have spent so much money on over time before they finally come to the realization that they're gaining all their weight back. The statistics show that if you're 90 pounds overweight, there's a 97% failure rate with just dieting alone. And anyone who's been on a diet, who's struggled to get that much weight off, knows, like I said before, if you lose 50, you gain 70. If you lose 90, you gain 100. And the problem is that the weight loss doesn't stick. Many of my patients who come to me for surgery have said, I've lost and regained 100 pounds several times in my life. I just can't keep it off. So way back in 1991, the NIH did a landmark study comparing patients who were on really good doctor-driven diets versus people who had surgery. And how were those two groups going to compare? They proved that only surgery was proven effective in the long term for most patients with the clinically severe obesity in the higher weight ranges, like 80 to 90 pounds and up. But why is that? Why is it that diets don't work for the people who really need them the most? One of the answers is ghrelin. Ghrelin is a natural hunger hormone that we all make in our bodies. Increased levels of ghrelin in our bloodstream make us feel hungry. Decreased levels make us feel full and satisfied. Dieting actually increases your ghrelin levels. So you start out on your diet and you're really motivated and you get rolling and the weight's coming off and it's getting harder and harder and you're getting hungrier and hungrier, and it gets to the point a couple of months into the diet when you feel like, geez, I'm so hungry I could eat my own hair. It's because your ghrelin is going up and up and up, and you eventually fall off the diet because your body chemistry has changed, and you gain back more weight than what you lost, and your ghrelin is higher than when it started. The gastric bypass and the sleeve, for unknown reasons, actually decrease the ghrelin levels. That's part of what my patients describe as the magic of the surgery. They literally wake up from the surgery with no interest in food because their ghrelin has plummeted. This is Kelly. Kelly came to me as a nurse here in town, seeing things from a medical angle. She saw people struggling with their weight in her hospital. She watched people dying of obesity in her hospital and just said, I got a little girl to take care of. I don't want to be one of those people dying from obesity in my hospital and no one can help me because my disease is taking over. So here's Kelly afterwards. She's an absolutely beautiful woman. This is a picture of Kelly with her before surgery pants, which I always tell people to save. And this is Kelly on the right down in Mission Bay in San Diego doing her exercise. And of course on the left with her little girl playing golf. A lot of people ask me, what about extra skin? In this picture on the right, Kelly has not had any skin removal and she's down from about 400 pounds. One of the things that sets gastric bypass and sleeve gastrectomy apart from just dieting is that those two operations actually increase your metabolism, as opposed to just dieting, which can have a tendency to decrease your metabolism. Anything that increases your metabolism actually helps your skin shrink as well as helps you lose weight. So that's one of the major differences between surgery and just dieting, is that the gastric bypass and the sleeve actually help your skin shrink. The vast majority of my patients do not get skin removal surgery. So let's talk about the surgeries themselves. Laparoscopic just refers to doing the same surgery internally, just through little tiny incisions. Open surgery is doing the same operation internally, but through a big old-fashioned incision. Now, many operations are done laparoscopically now. Whether it's abdominal surgery or even knee surgery, hip surgery, we're doing surgery through little tiny incisions in just about every field of surgery. But the open incision is still an option if patients have had prior surgery with lots of scar tissue that doesn't allow the surgeon to do the internal surgery through little tiny incisions. So it's important to realize that the surgery is the same internally. What's different are the external incisions. So who qualifies for surgery? It used to be the same for all three operations, bypass, sleeve, and band, but the FDA lowered the weight limit to be able to get a band. It's based on your body mass index. If you're wondering what your body mass index is, it's a calculation of your height and your weight together. If you go to the Who Qualifies button on my website, there's actually a calculator there that will help you calculate your body mass index. But if your body mass index is 40 or more, you qualify for any of the surgeries. But what if you're a little bit on the lighter side and your body mass index is only 35, but you have some weight-related medical problems? That qualifies you for surgery. At the lower weight, you just have to have some of the weight-related medical problems that we talked about. That 35 was lowered to a 30 for the band. So you can qualify for the band at a lower weight. But go to the calculator on the website and you can put in different weights associated with your height and play with your body mass index.